Hi, I'm Dr. Jomaa. Welcome back to my channel and this series on osteoarthritis. We've covered a lot of ground so far in this series. We've talked about the sports physician's clinical approach to osteoarthritis, how the diagnosis is made, what the underlying pathophysiological features of the condition are, what the primary risk factors are for osteoarthritis, the causes of pain, and the relationship between exercise and osteoarthritis. If you've missed all of that, then I recommend you go back and watch some of the previous videos. Now we're going to start talking about some of the treatment options that may be offered in the setting of osteoarthritis. And in particular today, we're going to talk about the role of corticosteroid injections. You may be watching this video because you've already been offered a corticosteroid injection, or you know someone who has. In today's video, we're going to talk about what exactly a cortisone injection is, how it works, what its benefits are, and what the potential underlying risks are. Remember, this is just educational and informational content, and any decisions made about your care is very individualized and personalized and should be had in conjunction with your healthcare professional. With that said, however, hopefully this video can give you some pointers in terms of how to start thinking about these injections and the types of questions that you might want to ask your doctor when you go see them. So what are corticosteroid injections? Well, simply put, corticosteroid injections are a synthetic version of cortisol. The hormone cortisol is produced naturally in our adrenal glands during times of raised stress or inflammation, and it helps the body cope with high levels of stress. The hormone was first identified and soon after synthesized in the 1930s and 1940s. All of the commercially available corticosteroid injections that we use are synthetic versions, and essentially these versions have the same effect as cortisol, but they can last a little bit longer on the shelf and in our bodies. If you've watched my previous videos, you'll know that the primary causes of pain in osteoarthritis are typically due to inflammation of the synovium. This is especially the case during a flare in osteoarthritis, where the knee may become hot, red, and swollen. If your doctor deems it appropriate, then a cortisone injection at this time will block that inflammatory process. As a result, a joint can have a rapid onset of reduced pain and reduced inflammation and leave you with a happy patient. Now, if you're thinking that sounds a little bit too good to be true, you're probably right, because there are some cons to this medication as well. First of all, cortisone injections typically only last for about 6 to 8 weeks. This may be a little bit less or a little bit longer in different patients, depending on how their body responds to the cortisone injection. Now, you may be thinking, okay, fair enough. Why don't I just go and get a cortisone injection with a regular top-up every 2 to 3 months to help manage my pain? And that's not actually too unusual. I've got patients in my clinic who have had recurrent corticosteroid injections into a joint before they've come to see me. The typical story is your middle-aged man or woman who's come in with a very sore knee, gets a cortisone injection in their knee, and it feels great. They go and play golf that weekend, they play a really good round, and things seem to be looking on the up for the next 2 or 3 months before that pain starts to gradually build up again. The niggling in the joint comes back, the stiffness, the aching, and so they pop back into their doctor and they say, look, I had this cortisone injection a few weeks ago. It did wonders, it's worn off, can I get another one? The problem is, the second cortisone injection maybe is not quite as potent as the last. And this is a very typical pattern. Usually by the 4th or 5th cortisone injection, patients will notice a significant reduction in how effective it is at controlling their symptoms. What's worse is that we are not considering the long-term effects of cortisone at this stage. In osteoarthritis, we have an inflammatory and catabolic environment inside the joint, which promotes degeneration of our tissues. Whilst the cortisone injection will significantly reduce the inflammation, cortisone is a catabolic agent. What that means is that it actually blocks growth and repair. When we inject cortisone into a joint, it's like putting a fire extinguisher inside the joint. All the hustle and bustle of the inflammatory process, which is part of the growth and repair cascade in the joint, is suddenly put to a screeching halt. And so when that cortisone's worn off, not only have you got your same problem that you had before, but you've also had a 2-month period of less growth and repair because it's been blocked by that catabolic agent. A one-off injection here or there is not going to make a massive difference, but studies have shown that recurrently injecting cortisone into a joint can have detrimental effects in the medium to long term. Sadly, despite this, it's a very mainstream practice, and sports physicians, orthopedic surgeons, and rheumatologists will reach for a cortisone injection as a first-line treatment. Corticosteroid injections do have their role, and they're very effective medications. What it takes is an understanding as to what's happening as an underlying process and whether the cortisone injection is going to add value or take it away. It's a case-by-case decision. Osteoarthritis is increasingly recognized now as a systemic low-grade inflammatory condition of our joints. As well as feeling stiff and achy in order to try and protect and preserve the joint while it recovers, inflammation and the swelling or effusion inside of a joint has other side effects as well. One of the side effects of inflammation in a joint is that it causes a reduction in the deep sensation of that joint, known as proprioception, which is our awareness of where that joint is in time and place. To make matters worse, when a joint is inflamed, the muscles that surround and stabilize that joint are generally switched off, and so the inserting tendons which wrap around and support a joint will become weaker and less responsive and less active. This can mean instability of the joint and a delay in rehabilitation. So when we consider these factors, sometimes a cortisone injection is probably the right way to go. This is the case if we have a patient who's motivated, has time to rehabilitate, but is being held back because they can't quite get muscle activation and they're in too much pain to get started. In this setting, a cortisone injection can switch off inflammation. The muscles and the tendons around the joint can start turning on. We get a return of our deep sensation and we can rehabilitate much more effectively. So a cortisone injection timed well with a course of rehabilitation in the right hands and under good supervision, sometimes one of the best things to turn around a sluggish condition and can really get a patient moving again. However, a bad indication for a cortisone injection would be a sedentary, elderly patient who comes in complaining of knee pain, gets an injection into their knee and just goes home and sits on the couch and watches television. By the time they've had their 5th or 6th injection, they start to realize that they're not getting any benefit in terms of pain control, and in fact, they're only suffering the local and systemic side effects. Risk factors of cortisone injections include localized infection, localized skin pigmentation, fluctuations in blood sugar control, fluctuations in mood. When used at high doses for a long period of time, cortisone affects all of the collagen in the body, and we can start developing paper-thin skin, osteoporosis, and breakdown of muscle tissue throughout the body. Corticosteroid injections are commonly used in the elite sport setting. A patient coming in to the semi-final or grand final of a major tournament will not want to miss out. They're more than happy to have a cortisone injection into that shoulder or knee or hip to settle down the pain and facilitate their participation in sport. It's worth mentioning that cortisone injections are now banned during competition, according to the World Anti-Doping Agency, but we can still use them outside of the competition window. So in summary, cortisone injections have a significant role to play in the management of osteoarthritic joints, particularly to help reduce pain, to facilitate participation in a sport, a holiday or a sports event that's been long booked, and to help buy us time when we need it, and also to help facilitate high-quality rehabilitation. On the flip side, however, cortisone injections are not beneficial when recurrently used and when they're not part of a targeted rehabilitation plan. And ultimately, they can further degenerate a joint and lead to worsening of the underlying condition. Hopefully that's informed you a little bit about how corticosteroids work and what effect they have in the body. If you've got any questions or comments, please leave them down below. Remember, this is a conversation you need to have with your healthcare professional, and hopefully this has helped inform you to ask the right sort of questions when you come to be offered a cortisone injection. Thanks again for watching. If you liked this video, please do leave a thumbs up. And if you're interested in this sort of content, please do subscribe. Stay active and stay healthy, and I'll see you in the next one.